Hello and welcome to Health Coaching in Clinics. If you're a doctor, a clinic owner, an allied healthcare professional, you've probably heard the term health coaching more frequently over the last few years. Perhaps you've seen other practices implementing it. Or maybe some of your patients have mentioned working with a coach previously to you. I'm sure that some of you wondered if this isn't simply another healthcare trend that will disappear in a few years. Today, I'd like to answer one of the most common questions I hear from healthcare professionals. That what exactly is health coaching and why should I consider integrating it into my practice? I'll show you some interesting study and findings later on in this video. But first, let's clarify what health coaching actually is. So, health coaching is a structured, evidence-based approach that helps patients bridge the gap between knowing what they should do and actually doing it consistently. As health coach, I'm a behavior change expert here to support people to achieve their health goal and design healthier habits sustainable in the long term. What, as a health coach, I have more of is time, and true behavior change requires a lot of time. And if we are honest, that is often where healthcare faces its greatest challenge. Most patients already know what they should do, that they should exercise more, they know they should improve their nutrition, and they also know that they should manage stress, they know they should take medication as prescribed by you. The problem isn't actually a lack of information. The problem is sustainable behavior change. That's where health coaching comes in. A health coach works alongside patients to help them identify meaningful goals, overcome barriers, build confidence, and create realistic action plans that fit into their own lives. It's not about replacing medical care. It's about supporting the implementation of medical advice. Think about it this way. As a healthcare professional, you spend years developing expertise and in diagnosis, treatment planning, and clinical decision making. You provide patients with the best recommendations possible. Yet, many patients leave your consultation room fully intending to follow those recommendations and then struggle to implement them. Life gets busy, motivation fluctuates, stress increases, habits difficult to change, inner dialogues are often negative. The result is that many patients fail to achieve the outcomes both they and you as a provider hoped for. Health coaching helps address that gap. Now, one misconception I frequently encounter is that health coaching is simply giving advice. In reality, effective health coaching involves much less advising and much more facilitating than what we can think of. A coach helps patients explore their motivation. They ask powerful questions and encourage reflection. And support accountability, it's so important. Most importantly though, coaching helps patients become active participants in their own healthcare journey. This distinction matters because lasting change rarely happens when people are told what to do. Lasting change happens when people discover why change matters to them personally and develop confidence in their own ability to succeed. Let's consider a common example. Imagine a patient with type 2 diabetes. You provide excellent clinical care, you discuss nutrition, you recommend increasing physical activity, for example, you explain the importance of blood glucose management. The patient understands everything. Yet, 3 months later, little has changed. Not because they don't care, I don't think so, but because changing long established habits is incredibly difficult. A health coach can help that patient break larger goals into manageable steps with regular meetings. They can help identify obstacles. They can provide ongoing support between appointments too, and they can help maintain momentum over time. It's always the relationship that heals. That's what I believe, at least. The result is that often better engagement and improved adherence to agreed treatment plans. I hope it makes sense so far. But if you want more information, please request a call with me using the link in description somewhere. Now, let's look into another question healthcare professionals often ask is whether health coaching is supported by evidence. The answer is definitely yes. A growing body of research suggests that health coaching can positively impact a range of outcomes, particularly in chronic disease and chronic pain management, lifestyle medicine, preventative healthcare, and patient self-management. There is a publication, for example, one of many in the BMJ called Integrative Health Coaching. I leave the resource link if you want to read it here in the description, that suggests that health coaching does all that while helping reduce pressure on clinical services too. Studies have shown improvements in areas such as physical activity, nutrition behaviors, medication adherence, weight management, and patient activation. While health coaching is not replacement for medical intervention, it can serve as a valuable complement to a traditional healthcare delivery. And that's an important point. Health coaching works best as part of an integrated healthcare approach. It's not an alternative to medicine, not at all. It's just a support mechanism that enhances the effectiveness of medical care. Now, let's talk about why this matters specifically for healthcare professionals. Many clinicians today are experiencing unprecedented pressure. Appointments are always shorter. Patient complexity is increasing. Chronic diseases, unfortunately, continue to rise. Administrative burdens consume valuable time. Meanwhile, patients often need more support than can realistically be provided within a standard consultation, even in a private setting. This creates a difficult situation. Clinicians want to help. Patients need support, more support. But time is limited during and after consultation. Health coaching can provide the additional layer of care that extends beyond the consultation room. It creates continuity. It allows patients to receive guidance and encouragement between appointments. And it can help healthcare teams focus on working at the top of their scope of practice as well. For clinic owners and healthcare leaders, there are additional considerations to be made. Patients increasingly expect personalized care. They want support, not just information. They want partnership, not just instructions. Integrating health coaching can help practices deliver a more patient-centered experience while supporting improved engagement and satisfaction of the patients. Yesterday, for example, I had another concern from a doctor I met in London. She asked, if I introduce health coaching, won't patients become confused about who is responsible for their care? The answer depends on how the service is structured. In a well-designed model, roles are clearly defined, and I tend to do that. The physician remains responsible for diagnosis, treatments, decisions, and medical management, generally speaking, where the health coach focuses on behavior change support, goal setting, accountability, and patient engagement. Rather than creating confusion, many practices find that this collaborative approach enhances patient care. Patients feel supported from multiple angles. The healthcare team works together, and everyone remains within their professional scope, which is also very clear. Then she also asked me to address the financial question. Doctors wonder whether integrating health coaching is worth the investment. While every practice is different, It's important to consider both clinical and operational outcomes. Improved patient engagement, better retention, enhanced patient satisfaction, stronger long-term relationship, a potential improvement in chronic disease outcomes as well. Well, all these factors can contribute to the overall value health coaching brings to a practice. However, the most successful organizations don't adopt health coaching simply because it's profitable. They adopt it because it helps them deliver better care. And when patient outcomes improve, many other benefits naturally follow. We can talk more about that if you book a call. I'll be happy to do that. Ultimately, health coaching is about helping patients succeed. The way I work is to collect some of those data along the way, check before and after the coaching program, so practices will be able to evaluate if it's worth an investment in my case. Understanding the behavior change is complex, and it's about providing patients with a modern type of support they need to turn good intentions into lasting actions. As healthcare continues to evolve, we are seeing a shift from treatment towards ongoing partnership. Health coaching aligns beautifully, I would say, with that shift. It empowers patients, it supports healthcare professionals too, and it creates opportunity for more sustainable health outcomes. So if you've been wondering whether health coaching has a place within your practice, I encourage you to think about the patients who struggle despite receiving excellent medical advice. Think about the patients who know what to do but find it difficult to follow through. Think also about the patients who came to your clinic because in need of more support than time currently allows. Those are often the patients who benefit most from health coaching. I would talk about this for hours, but now I'd like to thank you for joining me today. In the next video, I'll explore another important point. What really happens after the consultation? Do patients tell you? I hope you'll join me for that reflection as well. Thanks again for watching. And if you found this interesting, please subscribe to my channel. See you soon.